Okay, you can see my screen, right?
Right.
Okay, good morning, good evening, good afternoon for everyone, wherever you are. It's really my pleasure to be with WebCeph today again for the second time in less than 1 month. My name is Ahmed Hennawy. I am a member of Royal College of Edinburgh, Glasgow, and England. And I am orthodontist specialist. But 1 second, I have something. Look here. Okay. So now or today we will talk about management of the open bite. For a lot of doctors, the open bite represent they can consider the open bite as a complicated case, and they are scared to deal or to treat the open bite case. Today, we will try to think how we can organize our mind so we can deal with the open bite case. And to do this, we need to think about definition, etiology of the open bite, and the proper diagnosis, and treatment option and treatment mechanics. So this is what we will talk today. What we mean by open bite. Open bite is one of the discrepancies that occur in the vertical plane. When we have an open bite, we have we have lack of vertical overlap between the maxillary and between the mandibular dentition, and it can happen in the anterior or in the posterior region. The open bite can happen anteriorly or posteriorly. The percentage of the open bite is not so much, as we can find not more than 1% of the population have this type of the malocclusion. And honestly, the open bite considered as a challenging in all